Good morning, Dr. Boris Nektalov from Nektalov Health and Wellness. So today's topic is why would somebody need to get adjusted even though if they don't have pain? So chiropractic has been around over 100 years. In the 50s or early 1900s, a lot of chiropractors were prosecuted practicing medicine without a license. That's what they would say. You know, today we're getting so many calls from, in fact, yesterday I was speaking to a medical doctor who called me and I asked him, how'd you find me? He says, online. And one of his patients needed a spinal decompression chiropractic. So people are getting around and understanding that even though you don't have pain, they still need chiropractic. What is this all about? The chiropractic adjustment is all about. So as a chiropractor, we take care of the spine. Why would we take care of the spine? Because your spine surrounds and protects the most important organ in your spine, right? So your spinal cord, which is inside the spine, and then your brain sits here in is surrounded by the skull. Your nervous system is the most important organ. Why? Because it controls everything in your body. For me to move my arm, for your heart to beat, for your lungs to breathe, for you to be able to digest food, for you to understand what I'm saying right now. The brain has to send message down the spine, out these nerves, right? So when your spine is properly aligned, there's no interference. What we look as a chiropractor by taking an x-ray and an exam, we look how's the nerve compared to the spine. Meaning if the bone has misaligned, it can directly interfere with the function of the nervous system. So our job primarily is to take that pressure off the nerve. So, in fact, a good friend of mine, you know, he's a medical doctor. I'm not going to mention a name, but he sends a lot of patients. He truly believes that chiropractic can help his patients. You know, and then one day I asked him, listen, you send your patients, how come you don't get adjusted? So, and his answer was, listen, I don't have pain. So at that time I didn't really get into it, but today I'm gonna send a message. I know he's gonna watch this video. So is it possible to have a fixation, like a facet joint fixation, and the joint is not moving and not have a pain? Absolutely, right? Or is it possible to have some type of a beginning stages of bulging disc and not have pain? Absolutely. Why would that happen? Listen, we're facing gravity every single day. We're getting older. The more pressure, the more pressure on the joints. So the joints are not moving as we need with range of motion. So why would somebody need to get adjusted? To create better mobility of the joint, right? So when we get that mobility of the joint, the facet joint, there's a better circulation of the joint, and you will prevent pain. So overall, I get adjusted. I try to get adjusted on a weekly basis, not because I have pain, because I want to prevent pain. My kids get adjusted. Why would somebody need to get adjusted as a child? They run, they bump. They also have a spine, by the way. They fall. Your nervous system directly working together with your immune system. So when my kids, for example, they get sick, not to say that that's what we give instead of medicine, but we use chiropractic to prevent problems. Thank you for joining us. For more information, please visit us at our website. Follow us on Facebook, Twitter, YouTube, and Instagram. See you soon.